We are prepping to go live on Facebook. All right, we are now live on Facebook, and I'm going to turn it over to School of Nursing Dean Hayden.
Well, hello everyone. I'm Dr. Sonia Hayden. I'm Dean of the School of Nursing here at the University of Louisville. I'd like to welcome you here tonight for our year-long celebration, the Year of the Nurse. Many of you know that 2020 was designated as the Year of the Nurse by the World Health Organization. And there have been celebrations going on around the globe for this. I think it's very important for everyone to know that registered nursing is at the very top of occupations in terms of job growth in the United States. And this is going to continue through 2029. You know, the U.S. Bureau of Labor has projected that 1,705,000 openings for RNs each year are going to occur. And this is taken into consideration even our retirements and people leaving the workforce. You know, schools of nursing across the U.S. have been challenged this year. And unfortunately, they've had to turn away about 80,000 applicants from baccalaureate and graduate programs. And this has been due to a variety of factors that schools of nursing face, everything from classroom space to clinical sites and budget constraints. I want to make sure everybody knows that for me personally, U of L School of Nursing has the goal of increasing the number of nurses being trained to ensure that there are enough nurses in the positions here in the Commonwealth. I want to make sure everyone receives the safest and best nursing care possible. The research has shown us that an increase in a nurse's workload by just one patient will increase the likelihood of dying within 30 days of admission by 7%. And then we also know that researchers have found every 10% increase in baccalaureate degree nurses on the floor is associated with a decrease in mortality or patient death by 7%. So you can understand why it's so important that we educate baccalaureate prepared nurses. I hope all of you will enjoy this evening. Tonight, you're going to hear from some Cardinal nurses and learn about the remarkable work taking place in our community. Cardinal Nurses on the Front Lines is a two-part virtual event to celebrate our own Cardinal nurses who have committed to providing health care that promotes fullness of life, while sometimes actually risking their own lives, especially during the COVID-19. So I hope you'll sit back this evening and enjoy. I'd like to turn it over to our U of L Cardinal nurse, Bill Hayden.
Thank you, Dr. Hayden. It's great to have everybody here tonight. I was looking through the attendees earlier and I noticed we've got a lot of people, friends from around the country. We've got current students, we've got alumni. It's just fantastic to have everybody here. So again, my name is Bill Hayden. I'm a 1997 graduate from the University of Louisville School of Nursing with my BSN. I'm married to a Cardinal nurse, actually. My wife, Deidre Hayden, Dr. Deidre Hayden, as I'm instructed to call her now, is a graduate of the University of Louisville in 1997 and 2009 and 2019. So she's been around for a while. And she's an assistant professor. My daughter is actually a nursing student at the University of Louisville. So she's studying to be a Cardinal nurse. And our son's actually studying to be a pharmacy tech. So we aspire to open our own hospital once everybody graduates. So it's very exciting to be here tonight. As Dr. Hayden said, we're going to have 3 segments featuring some amazing Cardinal nurses that during this time of COVID and our pandemic, it's hard. But even without the pandemic, the acts that they take, the actions that they take, the perspectives they can share, and the experiences they've had are remarkable. So we're going to try to mix it up a little bit tonight, try some different types of media. So we're not experts. So if we mess it up, be patient, but we're thrilled to have everybody here tonight. So our first guest is Dr. Ashley Anderson, and I can't introduce her well enough, so I think we're going to start with a little video. So Maureen.
One, two, three.
Hi, I'm Ashley Miller. I'm co-owner and women's health nurse practitioner at Athena Health and Wellness. This facility is a dream come true for Carrie and myself. We've always envisioned a place that really catered to a woman through the lifespan outside of pregnancy, and also looking at a model of healthcare that was interdisciplinary and truly pulling different healthcare providers from different parts. We really believe in treating a woman and caring for a woman from mind, body, and spiritual perspective, and that's very important in health and total health.
Well, hello, Dr. Ashley Anderson. How are you?
I'm doing well. How are you?
I'm great, thank you. It's great to have you. So you have both your master's in nursing and your PhD from the U of L School of Nursing,
Yes.
but you didn't start there. I mean, you had
No.
to start somewhere. So
Right.
you're a Louisvillian.
Yeah.
You broke records in basketball, playing for Berea, right?
Yeah.
You've been a model. You've done pageants. It's like, is there anything you haven't done? Your wife, you're a
Sit
mom.
down. That's what my husband would say. You were not sat down.
Exactly. And so you're a wife, you're a mom, and you're a small business owner. So tell me a little bit, tell us all about Athena.
Oh, Athena has changed me, really. You know, Carrie and I, who's also a nurse practitioner, she's not a Cardinal nurse, darn. Still love her anyway. I know, right? But we wanted a space to care for, help, nurture, pour into women that was outside of pregnancy, you know, because we felt like oftentimes in larger practices that saw both pregnant and non-pregnant patients, that women that were not pregnant weren't the high priority, right? Like,
Right.
you know, someone might go into labor, you sit in the lobby for 2 hours, you know, it ain't your turn. So we wanted a space that was specifically for women outside of pregnancy, and that's what we created. So it's really been a dream and a journey. We are able to care for even young girls that are having, you know, female issues and menstrual issues and hormone issues. I think our youngest patient right now is 11.
Wow.
All the way up. I think my oldest patient right now is like 83. And so it's beautiful to have the opportunity to do it our own way. You know, we're not on someone's time schedule that says you've got to see a patient every 10 minutes, because that's the space we came from. And we both agreed that that's not why we got into this profession, that we wanted to be able to spend time to really get to know our patients, to find out what makes them tick, and really find out the things that you can't get to on a medical history in 10 minutes.
Right.
With an exam. So we really have been successful at creating that space. And I'm really proud of that.
So you started at University Hospital
Yes.
in labor and delivery, mother, baby.
Mm-hmm.
And then you decided you wanted a little bit more. You went to school, got your you got your nurse practitioner, your master's, and then you went to work for Planned Parenthood. So
Yes. Mm-hmm.
You worked there quite a while.
Yeah, I was there for 7 years. And, you know, I actually had no intention of doing women's health at all. When I started, I just thought I really love babies and I wanted to do neonatology. So when I graduated, I was leaving Berea and started interviewing, I had in my mind I was going to the NICU. And to my surprise, I couldn't find a job.
Wow.
The problem was I didn't have any experience, and obviously going into NICU, you got to have something. So my master plan was to get a job in the mother baby unit, cross train in the newborn nursery. Then I would kind of transition there, get some experience, and then hop over to the NICU. Well, I fell in love with working with the moms and being able to connect and relate to them, just woman to woman. I absolutely hated working with the the babies. I mean, there was one night I was in newborn nursery and I feel like all 17 babies started screaming at one time. And I was like, I'm about to shave my head. Like, I'm not going to make it.
Been there.
Yeah.
Get it.
Yeah. So that actually spurred me on the women's health path. And I mean, I loved what I did, but I also felt like that I could do more. And I
Right.
also was seeking a better quality of life because I was working night shift, 7P to 7A. We were short staffed. So I was working like sometimes 5 shifts a week. It was just a lot. And I knew that I wanted in the future to have a family. I wanted to have more time where I wasn't like on call or something like that. So I felt like that was the first route to take is going back for my master's. So I worked 1 calendar year and started the program that next summer. And worked until I couldn't do it anymore once clinical started. And during my clinical rotation for my master's program, I was placed at Planned Parenthood for gynecology. Loved working with the women there and really learned a lot about family planning. And what I became really passionate about, which was later my dissertation topic, was teaching young women how to prevent pregnancy, you know, if that's
Right.
what they desired, and teaching them basically pulling those characteristics. I studied self-efficacy for my dissertation and finding those characteristics about the girls that were doing it right and trying to figure out, is that something we can teach to other young women so they feel empowered to prevent pregnancy and to stay safe. So stay there for 7 years. We had a lot of transition towards the end in terms of management, and like we merged with an affiliate in Indiana. It was just a lot of changes. And I felt like I needed to bow out. We actually, prior to that, had a CEO that was a nurse. So we were spoiled in the sense that she understood the patient care model. She understood scheduling and why it mattered that we were able to spend more time. And that wasn't necessarily the case after the merger. So Carrie and I both were like, you know what, we need to do this differently. And I went to school to do this in a way like that I could be proud of. So we started meeting every week for a couple of hours and sat and talked about what we wanted the space to feel like, how we wanted it to look, how we wanted women to experience healthcare.
Right.
And I mean, we did it in 8 months. We opened in 8 months.
Wow.
Yeah.
So it's interesting because you know, when you and I talked, and you just talked a lot about self-care, self-efficacy, everything you've done has been very research driven. And I think it's interesting. You ran for state senate. So, or to be a state representative.
Yeah.
And, you know, through that process, you talked about legislation by research. I think we've got a picture. There you are on the campaign trail. And, you know, you talked about legislation based on research or research-based legislation. And I just found that a very interesting concept. How is that received by, you know, the public and by your fellow politicians, I guess I should say?
What's interesting is the public was like, that makes a whole lot of sense, you know? And I won't say that politicians were not open to that. However, it's not the way it's always been done. And, you know, we take health policy, right? And I remember one of our assignments during my health policy class was finding a problem, researching how other states were doing it, figuring out who's kind of doing it the best and having the best outcomes, and creating legislation based on that. Like for me, I looked into the Medicaid programs and how some states kick women off after 6 weeks after they have a baby, and then how others let them have it for a whole year and all of that. So to me, it made very much sense, you know, like, why would we not look at who's doing it and who's doing it the best and model ourselves after that instead of having to reinvent the wheel? It's the nursing process, right? So in my mind, I felt like the general public was very open to that because it felt like it made very much sense. But, you know.
I get it.
Yeah.
So, you know, you make no bones about the fact that you and Derek both had rough childhoods and rough upbringings. And, you know, you had a lot of challenges. And being an African American woman in the United States and in Louisville, you know, you had a lot of challenges and you've
Mhm.
overcome those challenges. And I know one of the opportunities you had was to interview our 2019 Nursing Alumni of the Year, Flora Ponder. And I'd like to get, and I know ironically enough, Brittany also interviewed her, but I
Mhm.
would like to get your take on what you took away from that conversation.
Wow. I mean, I don't even know how to put that briefly, but Miss Flora is amazing. You know, like it's one of those things, like you said, yes, I've endured things in my life, but to be in a space that she was in and to stand up and say, you know what, this is what I want to do, and I'm going to make it happen no matter how much the odds in the system are stacked against you. Like that was powerful. And she's such a sweet little lady.
Oh,
Like
yeah.
you just don't even, you know, she's feisty though. And
Oh,
I
my
love
gosh.
that. I love that about her. I love feisty women, but I really just, after talking to her and just reflecting, I thought, you have no excuses. Like, you have absolutely no excuses. It's because of women like her, trailblazers like her,
Yep.
that I had the opportunity to pursue a nursing degree, pursue a master's, pursue a PhD, even have a practice today. So, I mean, I just literally was in awe of her. And I just really felt like the sky is the limit.
That's amazing. Yes,
Mhm.
you know, listening to her talk, and it's like everything her litmus test for a decision was, is it good for people, because she
Yeah.
loves people. And I'm
Mhm.
like, that's just incredible.
Yeah.
And for those of you that don't know, you've kind of Google her, because she's Miss Flora is really, really cool. She started EMS in West Louisville. I mean, it's too much to talk about. It's amazing. So,
Mhm.
um, so you played basketball.
Yes.
And I mean, you weren't planning on playing basketball in college, but it
Not at
sort of
all.
worked out that way. And so
Mhm.
you went on to play basketball at Berea. And I'm from a nursing family, and I think you're from a basketball family. Is that right? Your
Yes,
husband might play basketball occasionally.
he may.
Yeah. Well, he went to a basketball school, not U of L.
Oh,
So
oh,
he
oh. So
he
I
went to
thought
U
you
of
and I were
K.
we were gonna have a wonderfully like amicable
Cordial
conversation
conversation.
today.
So you and Derek. So for those of you that don't know, Derek Anderson played for the University of Kentucky
Mhm.
and went on to play for the NBA. And now you guys are working together on the Stamina Foundation.
Yeah.
So tell us about the Stamina Foundation.
Yeah, so it actually, Derek had been doing some of this work forever. He's been extremely passionate about pouring into youth, I think because of his upbringing. And through basketball camps, one thing that we have been doing is, you know, we give the kids a lot of stuff during basketball camp. Like every day we kind of had some kind of surprise for them. We had like Comfy Cow come in one day and give them free ice cream. We gave them little, you know, all kinds of stuff, shoes, bags, whatever. But what we decided is that instead of giving them things, they had to earn them. So what we asked the kids to do is to make a list of nice things that they'd done from the time they left camp the day before until they came back the next day. And it became a competition, basically. So they were just competing to do these acts of kindness. They had to write a whole list of whatever they'd done, have their parents sign off on it. And when I tell you, the parents were like, my house has never been so clean. Like they've been doing all sorts of things. You know, one kid is like used his allowance to take his mom on a date. They were like cutting grass for their neighbors, like all sorts of things. And it became part of who they were, because even months later, we were getting messages from the parents or even the kids like, oh, look what we did. You know, my neighbor is elderly and he's having a hard time, so I take his trash out every week. And we just felt like that's really what it's about, is trying to pour into their character, because it's easy to give money all the
Right.
time, right? But what do you do to change someone in their heart? I think that's what matters going forward. So that's where the whole acts of kindness thing came from, and paying it forward. So a lot of times you'll see Derek post things like, he's going to give out shoes for like back to school shoes, for example. But in order to be even entered in that drawing, you have to submit something nice you did for someone else. So that's really, it really came from the desire to change our community in a way that was meaningful over time. And I just really feel like that's the way you do it, is by getting to the heart of who these kids are and what they need, the manners, the common courtesy, just being able to get off their phones and look at people and have real conversations and acknowledge their presence. So that's really what we're working on.
Well, thank you for that.
Yeah,
So,
thank you.
okay, in 1 minute, tell me about what's your biggest COVID challenge as a provider, as a mom, as a caregiver to the community, with stamina. I mean, what's your biggest challenge?
Oh, wow. I think my biggest challenge is the tug of the heart, because the nurse in me knows that the community needs us right now, right? But then I'm also, my husband is healthy, so I'm thankful for that. But I have 2 babies under 3 that I have to be mindful of what I'm bringing home to them. I have my grandmother who's had 2 surgeries during COVID, and people like that we're around in terms of like caretaking and that kind of thing. So I think for me, my biggest challenge is, or has been, you know, we closed our practice for 7 weeks.
Right.
And realizing that our people need us, but we also have to care for ourselves. So that balance, finding that line of serving in the way that I was called to do, and then also being responsible for my family as well, has been difficult.
Well, thank you for that. So
Yeah.
thank you, Dr. Anderson. It's been great talking to you.
Likewise.
And now we get to transfer over to Dr. Ruth Stayton.
Woo.
So hello, Dr. Stayton.
Hello, hello.
How are
This is
you?
thrilling. That was so inspiring.
Amazing.
She's amazing.
Well,
Yeah.
it's not going to stop there, because we've got you next. So you and your work with with what you do in Louisville is just incredible. So Dr. Stayton is an associate professor and retired. Let's see, what is that? Associate dean? But I think you're more semi-retired or kind of retired. I don't think you're really retired.
I'm in
but,
control of my world. I'll say that.
Okay, there you go. So you're a transplant to Louisville. You're not from Louisville, but you've been a nurse for how many years?
45.
45 years, and 42 of those have been in psych nursing, right? Psychiatric nursing. So, and you've been at U of L for the last 7 years. So we're thrilled to have you. U of L has an amazing resource with all of your experience in nursing. And I know, you've got 2 community-oriented practice areas that you focus in, and your teaching and your students. So you're completely immersed in the COVID pandemic fight every day. But when you consider what you and I talked about, you're not necessarily in the traditional COVID fight, right? Vents and treatment. It's more mental health. So how have you been fighting that fight from that perspective?
Well, I'm really pleased that I get to share this, because I do think when we think about COVID, we're thinking about the images we see on TV, which really are horrific, with nurses in garb and healthcare workers and very sick people. But the other side of it is the mental health side of it, and the toll that both the worry and the concern about getting ill, being ill, having family members ill has created, but also the isolation that people are experiencing. And we're heading into winter, the numbers are up, and the difficulty that people are having with their anxiety, depression, even the healthy of us with lots of resources are feeling the impact. So it's been gratifying to me to be working with 2 community agencies that really have gone above and beyond to help the people within their care deal with the COVID-19 situation, and to provide community around them, which they otherwise might not have.
Well, a friend of ours talked about, what you see on television, what you see on the news is almost always negative, right? It's very few positive things. And so we miss the opportunities to see stories like the two agencies that you particularly work with, that we should see stories. And I'd want to start first with communities, or Choose Well Communities, I'm sorry. That is absolutely an incredible organization. And we've got some slides here that kind of look at, I think maybe from the first graduation of Choose Well Communities. So tell everybody about Choose Well Communities.
All right. Choose Well Communities was started by a couple of my wonderful board members, Stephanie Barnett and Kim Mascaro, wanting to do something to demonstrate the compassion that we have in Louisville. And they happened on to working with a group of women, mothers, who are in early recovery with at least one child under the age of 5. And what they discovered was that people, these families could get, and women could get treatment in residential programs. But once those residential programs were over, they really did not have a community to go to. So they were able to get housing vouchers to establish housing first, and then have created just this amazing wraparound for these families, the most vulnerable in our community, really, when you think about young women in recovery with young children. So they've wrapped around, they've got housing, they are getting support for living healthy and happy lives for themselves and their children. They are getting training and education support so that they can sustain their families financially. It's just really a phenomenal experience, and I feel so fortunate to be able to work with them. They, in March, when everything shut down, it was amazing, the response of this very small group of people. We have about 20 families right now. And so that's what we had in March. And in a heartbeat, people rallied to make sure that these families who don't have a lot of resources got the cleaning supplies and masks and food and everything that they would need to keep themselves and their children safe. We quickly made sure that they were getting financial support where they could get it, including unemployment and signing up for those kind of things. But it was just remarkable that we were able to support in a community sense these young women and their families, helping them manage teaching their kids at home and making sure that they had the computer resources. But I think all of those things, the material things, are really important, but the sense of community, that you are not alone, that we are here. We quickly converted, all, like in a week, converted all of our support resources to online Zoom meetings, making sure that they had access to their recovery community, both within our services and externally. So it's just really gratifying. And we've made it to this point, and we're still wrapping around these young families. But we had planned before COVID started that 9 of our women who have been with us for about 3 years, nine of our families, that they were ready to move on to independent living, that they would be alumni of ours, but they were really ready to stand on their own. And so in August, socially distant, we had a wonderful graduation celebration for 9 women and their families. And they, it was just amazing. Now I'll tell you, since then, and this is just amazing too, since August, we have 11 other families in the pipeline, and we know there are many more, and we look forward to being able to wrap those same kinds of community blankets around more families. So it's really gratifying and rewarding to be a part of this organization, and I think speaks well to the whole sense of community that we have here in Louisville. I think Ashley, listening to her, I was just thinking there are so many people so passionate about making sure that we provide the kinds of things that families need in our communities, youth, young families, elderly, just really gratifying. And I was reflecting on this morning. It made me think about how fortunate I was to end up at Louisville, because we're a community engaged university recognized by Carnegie. And I think that just gave me the opportunities that I've had. It put me in the right place to be involved in these community agencies. But Choose Well, and I know I have several of the board members on
Right.
with me, so lovely to see them. Just, it's a rewarding opportunity. I hope people who are listening will get on and look at their website, see what we're doing, and offer some support. Our families in our community need us, but to see these women fight through addiction and stand tall and raise their children, changing the cycle of difficulties in families is just terrific.
So it's a perfect segue to talk about your other community engagement that really you're able to involve students, and it was such an unmet need that you were able to fill, and that's with Jewish Family and Career Services. And I think we've got some slides from their website, and it talks a little bit about the services. So it's a clinical site, and talk to me a little bit about that area of your practice.
All right. Well, I have always been very engaged clinically. I want to take care of people, to be part of their journey to living the life they want to. And so I was very cautious. I wanted a place that I knew, kind of like Ashley, that I could live out my work in a way that was meaningful and not really constrained by some of the other, you've got 15 minutes to meet these people. So that's the theme I'm sure you'll hear. But Jewish Family and Career Services, if you're not familiar with them, again, just an amazing organization in our community, providing so much for the people that they serve. But they had a counseling section, and they do a lot more than just counseling, career services, food banks, educational programs, refugee and immigrant work, lots of activities. But they had a counseling section that was primarily social workers and marriage and family therapists. And they were eager to see if having somebody who could also provide medication management for their clients would be helpful. And it was just the perfect match for me. So I'm a psychiatric nurse practitioner, and I was thrilled to have the opportunity to work in an agency that was so mission and community minded. So
You engage your students there as well, right?
Yes. So great learning environment for my students as well. We see children to elderly, and everybody in between. So it's just really a wonderful, the rest of the clinical team is fabulous. There is so much heart and compassion. And in the same vein that Choose Well just got right to it when COVID hit, so did Jewish Family and Career Services. We immediately went to telehealth. I don't think we missed any appointments, and we got people hooked right up. We have a food bank, and they've increased the services and the resources to that. It's just a group of people who really want to make a difference in our community to the people that they serve. But one of the things that the clinical team has been so affected by with COVID is the isolation. And fortunately, we're there for our clients, but it just makes me think about how many people in our community need this sense of community that we
Right.
created through Jewish Family and Career Services and through Choose Well. Everybody needs that. And I know there are people that are isolated and don't have that. So that's a little kind of tough for me, but it's really rewarding. And I am concerned about going into this colder weather and holiday seasons, and the mental health for that difficult isolation that everybody's experiencing, but some people more than others.
And I know that's a perfect segue to talk about the last thing I want to talk about briefly, which is the work that you did with your MEPN students. And for those of you that don't know, MEPN is a master's entry level to the profession of nursing, which is U of L's program, which allows baccalaureate prepared nurses or baccalaureate prepared people, so anybody with a bachelor's degree, to start and actually graduate with a nursing or a master's degree in nursing. And so, they're a little bit, they work at a little higher level, perhaps on projects, et cetera. And you worked with those students with the Delphi Center using Adobe Spark, and you created websites. And I think we're going to show one here. And it's just an incredible project that, you talk about distance, isolation, feeling as part of a community, having your individual needs met. And this is spot on. So can you talk about this project a little bit?
I love teaching psychiatric nursing, and so I really do jump at the opportunity anytime I get it. And I agreed to this last January. Of course, none of us knew what was ahead, but the minute we realized that our students wouldn't be seeing clients face to face, I thought we've got to come up with something that really immerses them in this COVID experience, because it is a mental health experience. And so we let them pick their population, and you see the one you just looked at were people in prison. And we had the good fortune of having Jennifer Howe as one of our clinical instructors who works side by side with our prisons. And so just remarkable. I do want to give a shout out to the students, Daqua Ahmed, Safudi Soko, Shelby Tyring, and Jenna Lyons. They captured the essence of this experience for people who are fairly powerless and extremely exposed in this time of COVID, which are people who reside in prisons. So you'll see the science and the evidence woven into their experience. They presented this very comprehensive view, but most gratifying to me is that you got the compassion that these students had developed and their understanding of this experience for these clients, and the advocacy that comes through the, including policy advocacy that comes through this amazing web page that they did. It was beyond, and there were 5 others.
Right.
They were all really good.
I've looked through some of the others. They were just incredible.
So I was just amazed at their capability.
Well, thank you, Dr. Stayton, for all your work. It's so nice to be able to work with you as part of the Alumni Council and part of the school. So I appreciate all you do.
Thing?
Absolutely.
I am not a U of L School of Nursing graduate, but I had such high regard for it that I sent my daughter here, and she's a 2-time U of L School of Nursing graduate. So
wow.
Go Cards.
Go Cards.
Thank you. I do it, but I get it wrong, I'm sure.
Well, hopefully it translates to the screen. So we're going to switch gears now. We're going to go to our last segment of the night, which is with a thank you, Topsy. So with one of our current students, and I say current student, but Brittany Corneal is a current student in the DMP program, but Brittany actually graduated in 2017, I think in 2017. Brittany, smack me around if I got that wrong, with her baccalaureate degree in nursing. She's a remarkable woman, and I'm just super excited. And we're going to start this with another video that is a great introduction to her.
Well, we wanted to give you an opportunity to hear from one of our students today. And so I have the honor of introducing Brittany Corneal. She is a BSN degree graduate from our School of Nursing, and she's now working towards her doctorate in nursing practice. Her experience in the simulation lab has come full circle. She's someone who was able to learn there as an undergraduate student and is now helping to educate students in her role as a teaching assistant under Dr. Karen Turner. So, Brittany.
Good afternoon, everybody. I'm so excited and just grateful to be here today. First and foremost, as an alumni of the School of Nursing, because I personally benefited so much from all the experiences that I had in the simulation lab. This is the place where I was able to hone in on all of those fundamental nursing skills like prioritization, time management, communication, and teamwork. This is also the place where I first learned how to take care of my patients. There's one simulation experience in particular that I believe had the most profound influence on my nursing career today. In our maternal newborn nursing course, we have a postpartum simulation where we actually simulate a postpartum mother dealing with the loss of her infant after delivery. Anyone that has gone through U of L's nursing program can attest to how powerful this simulation experience is. It felt so real to all of us that after the day, my classmates and I were looking at each other with tears in our eyes as we were beginning to realize the level of empathy that would be required to take care of our patients. So when I actually started working on a labor and delivery unit and I had my first patient that had a loss of her infant, I was standing there trying to think of all the right things to say because I had never gone through this experience myself. I never had a family member that went through this experience, but I was able to look back on my simulation experience here at U of L and remember all of those things that my instructor told me I could say to offer encouragement to mothers in a time of grief. And I was able to see how a dark and sad day could be turned a little bit brighter by offering those words of encouragement that I learned here. So now, being on the other side of things as a teaching assistant, I get the joy of instilling all of that great knowledge and wisdom into the students, just how it was poured into me as an undergraduate student. As everyone has said today, Simulation Lab is such a safe place for for students to learn in order to make safe choices as a nurse when they graduate. So my heart today is just full of anticipation for all the great nursing students who will be trained in the lab that we're celebrating today and all the lives that they'll be able to touch because of the education that they got here. Thank you.
So, Brittany,
Yes.
you're somewhere, you're in there somewhere, you're in the computer in there somewhere. I can't see you yet, but I know you're there. So that was an amazing introduction. You know, one of the things that you and I talked about was the skills lab versus a sim lab and simulation, because, you know, when I was in a skills lab, right, it was the cubicles with the beds and, you know, occasionally maybe one of your fellow students laying in the bed. But a sim lab is something totally different. So for those of us who may be out of nursing school for a while, talk about, you know, the differences and the opportunities with simulation.
Yes, absolutely. So first of all, thank you all so much for having me on tonight. I'm really grateful to be here. Dr. Stayton was the associate dean when I was an undergrad, and she's always been so gracious to me. And Dr. Anderson is actually my healthcare provider. So us all being on this call together is just really amazing. So a skills lab is where you learn fundamental skills like taking blood pressures and reading heart rate monitors and things like that. You're just kind of getting those fundamental skills. Whereas in a simulation lab, you're putting it all together in a high fidelity scenario where it simulates a real patient experience. So you'll have a mannequin that has breath sounds that you can listen to with your stethoscope. They might blink at you, they might talk at you. You might be able to have students put IVs in the mannequin's arms and things like that. And so simulation is where all those concepts from class and from the skills lab come together for a simulated experience.
Very cool. And I know you have a mantra. hopefully you're going to remember your mantra because I'm kind of setting you up a little bit. And this seems to go really well with your mantra. Are you familiar with the mantra I'm talking about?
I have a couple, so you might have to help me.
So I'm thinking about the high tech, high impact, high touch. So that's like everything you do seems to be around that. And I know one of the other things we talked about was, telehealth versus what's the other term that I'd never heard of before? Mobile health versus telehealth. So talk to me about that and kind of explain that as terms for maybe nurses that aren't familiar with that.
Yes. So telehealth is actually doing some sort of patient visit or patient appointment, either through the phone or through an iPad, using like something like we're doing right now, doing a patient visit like that. So in my clinical area that I'm doing right now, I'd be doing a telehealth visit with a patient when I'm visiting them over the phone or through Skype or something like that. Whereas mobile health is actually using mobile apps on your phone to help with your healthcare. And so that's what I'll be focusing on for my DNP project, is I'm teaching pregnant women how to use pregnancy apps to supplement their healthcare. So that's kind of the difference there.
Excellent. So that makes perfect sense. And I know when you were talking about it, I wrote that down and I'm like, wait a minute, telehealth, mobile health, but that makes great sense. So perfect. So, you kind of talk about your DNP project. Expand on that a little bit, because there's definitely need. I think talking to Dr. Anderson, we see that continuity, that need continues even today.
Yes. So I work at University of Louisville Hospital as a labor and delivery nurse. I also work there as a prenatal education coordinator. So when the COVID-19 pandemic broke out, we had to switch our class to a virtual format. So we can no longer have the face-to-face class that we traditionally have. We have to do it over Zoom like we're doing now. So for my DNP project, I wanted to give my patients something extra they could do at home to learn more about their pregnancy and to have a healthy behavior during pregnancy, because I'm really passionate about maternal health outcomes, especially the health disparities that we see in those outcomes. And so education kind of gives those moms power to have more control over their pregnancy. And so I'm teaching them how to use pregnancy apps. I'm teaching them how to find a quality app, and I'm teaching them how to use apps to help them reach their goals. So that's what I'll be doing. And I'll actually be doing my presentation for my proposal for my project tomorrow morning.
And so how are you going to measure success? What are some of your outcome measures?
So what I'm going to be measuring is how frequently they've actually been able to reach their goals throughout the week and how often they're using the mobile health app. So I'm hoping, what I'm expecting to see is that my moms that use their apps more often have more success in reaching a health behavior goal. And so a health behavior goal may be they might want to eat 3 vegetables a day, or they might want to drink 8 glasses of water a day, or might take a walk for 30 minutes a day. Whatever their goal is, I'm measuring how frequently they're being able to do that throughout the week and see if there's a correlation between that and how often they're using their apps on their phone.
So what do you want to be when you grow up? When you finally graduate, what are you going to do?
I feel like I've become like a professional student. I've been at U of L since I was 18 years old. And so
And that's good for us, because you've been great.
So I really am interested in working in primary care. I'm specializing to be a family nurse practitioner. And so I really want to work in an underserved community and provide primary care to patients that come from vulnerable populations. I'm also interested in education. So I'm hoping I could teach, hopefully at U of L, Dean Harden, if you're listening, if you want to give me a job. Hopefully teach. I would like to continue teaching maternal newborn, just because that's my first love in nursing and the material that I feel the most comfortable with. So
very cool. But you want to do primary care versus a women's health nurse practitioner.
Mm-hmm. Correct.
So talk us through that.
Yes. So I work in labor and delivery now, and I work with pregnant women. I'm very passionate about maternal health, but I also kind of have a second love in nursing, which is like community-based nursing.
Sure.
And so I love taking care of women. I love taking care of babies. I also love educating about hypertension, and I love educating about diabetes and how to manage those types of things in life. So I kind of have 2 loves in nursing. I kind of got the first love out these first 4 years as a nurse on the unit, and I kind of want to tap into that next part of my life after I graduate as a nurse practitioner.
And isn't that cool that as a nurse, we have the opportunity to do that?
Exactly. Yes.
Right?
There's so many different things.
So, you and I talked, and we could go on. I could and spend an hour talking about all of your qualifications and everything you've done and how you're involved, and you're a leader, and you've always been a leader. Your academic, your performance and what you've done at U of L is remarkable. But I ask you, I'm like, okay, when nobody's looking and you're not being graded on it, how do you keep yourself motivated, and how do we encourage nurses leaving school to stay as active as you are in nursing, in the community, in leadership roles as a nurse? I mean, how do we do that?
It's really difficult because when you work on the floor as a nurse, you have so many different responsibilities, and you're really just trying to get through the shift to get to the next day. 12-hour shifts, especially if you're working at night, it can be a daunting task. So getting motivated to continue being involved, it really comes from actually seeing that being modeled in front of you. You can't really want something that you don't see happening. And so I think it takes a lot of mentorship from the seasoned nurses on the units to actually make us want to continue to do those evidence-based practice projects on the unit or do community service in the community, other than just doing our shift for the day. But we kind of have to see it being modeled in front of us. When I was an undergraduate student at University of Louisville, I joined an organization called the Black Student Nurses Association. And through that, I was able to join the National Black Nurses Association. And so Miss Alona Pack, who's one of our assistant professors, she took us to our first national conference in undergrad. And I was able to see all of these amazing nurses and nurse practitioners modeling that leadership, modeling that community service and being involved. And that made me want to continue to do those things. And so I think we have to mentor and look back at the people who are coming up behind us in order to give them the energy to want to do those things.
Very nice. So a couple minutes left. What is your takeaway from COVID, and what has been your biggest challenge?
So I think my biggest challenge is making sure I'm not allowing the fear to like override my compassion. I remember I had a patient come in, and every patient that comes into our triage, they get tested for COVID. And this patient was declining very fast, declining so fast that her results hadn't even come back yet. And we had to take her back for an emergency C-section. And in that moment, I couldn't even think about putting on my face shield and my gown and all those things. I just went straight to the OR to help this patient, exposing myself to what possibly could have been a positive patient, not even really thinking about it. But at the core of nursing is compassion. And sometimes you kind of have to forget about yourself. I always tell people humility is not thinking of yourself less, but thinking less of yourself. So, putting yourself in a situation to put the patient before yourself. It's not necessarily the biggest challenge, but not letting my fear stop me from treating patients the way I normally would is like probably the biggest thing.
Thank you for that. So thank you, Brittany, soon to be Dr. Corneal. I can't wait. So hopefully I'm there at your graduation. And I think we're gonna get ready to close up. But before we close up, we've got a couple more things we want to do. We've got a message from the president of the university, Dr. Neely Bendapudi. And so we're going to have that.
Some of you don't know this. You know me as a business professor. Some of you know I'm a recovering banker. You know I'm a professor. But along the way, for 1 year in my life, I spent studying Mayo Clinic. So 6 months in Rochester and 6 months in Scottsdale. Went to Rochester, Minnesota in the summer, Scottsdale, Arizona in the winter. Figured it all by myself. But I want to say that a colleague and I were doing research there. And being there and studying what provides they were studying what provides great patient care, but also what provides the right environments for our healthcare providers. I've written about it and so on. But through that, I spent so much time, including as a mystery patient, and made sure that the doctor and the charge nurse knew. That was the most important. I developed such an appreciation for what our nurses do. And I hope that everybody realizes that not only is the demand for nursing growing, but that their old ideas of what a nurse is and what a nurse has to do, they might want to revisit it because it is both high tech, high touch, and high impact. And so it's something that I've developed a genuine appreciation for.
And next week, I believe on our next segment or our next episode next Thursday, Dr. Bidapudi is going to be with us live. So that's pretty exciting. So the last thing I think we want to do before we close is I'm going to give an opportunity for Deborah Benton to talk about just the mission of the School of Nursing, the importance of the School of Nursing, and an opportunity for us to help the School of Nursing even be a better place for students like Brittany and her cohort. So, Deborah.
Thank you, Bill. And wow, what a hard act to follow after President Bendapudi, huh? Well, if there's one thing we have in common, myself and President Bendapudi, it's our admiration for the great work that these nurses do. And as Bill said, I'm Deborah Benton. I am not a nurse, but I am honored to be considered part of the School of Nursing as a development officer. And what that means is that I work with those that want to financially support those and these remarkable nurses, many of which you've seen tonight. And as you heard from Dean Harden earlier tonight, our community, certainly our local community, but even beyond our local community, we need a significant number of more nurses, especially in this nursing shortage. And we hope that you will consider supporting our goal to increase nurses in the workforce. Visit our giving page, which I think you'll see in the chat box. Mm-hmm. And on the chat box there, where you see that link, you will also, when you go to the link, you can find information how you could contact me. And I'd be glad to answer any questions that I can to explain how you might support us. And so please visit the chat box and the giving page. And just want to say thank you, though, for the support that you show, even by being here tonight. And that's really important in itself. So thanks a lot. And Bill, I'll let you close us out.
Thank you, Deborah. And thank you for asking me to do this. Dr. Harden, thank you for giving me this opportunity. And Adrian for helping us out, and Maureen for being such a great in the back end, doing all the wizardry in the back. So next week, same time, same Thursday of next week, the link to register is now up in the chat box. We'd love to have you join us for another 4 segments, 4 next week in 3 segments. Amazing people, or should I say 5. We've got 2 pairs next week in our segments, and they're going to be equally incredible and inspirational, and you're going to learn some things about things that are going on in Louisville that you didn't know. So we'd love to have you join us. Register, log on, and we'll see you next week. That was up.